Well, thank you, Chantal. If we could advance to the next slide, please. I just wanted to thank everyone for joining today's CDBG-CV Technical Assistance webinar for states. And thank you especially for the work you're doing to support HUD's mission and our programs. And I think probably now more than ever, your role in supporting your communities is more important than ever before. And I want to thank you as well for your input. A lot of the questions we've received have helped to shape the program, and we really appreciate you continue providing us with input as we move forward. On August 7th of this year, obviously, we signed the CDBG-CV Notice, which issued flexibilities that states and local governments can use when they apply for CDBG-CV funds that were appropriated by the CARES Act to best support their communities in the wake of the coronavirus outbreak. And to date, we've provided over $3 billion in CDBG-CV funds nationwide to help communities combat coronavirus and alleviate economic hardship. And as of August 18th, we've had more than 960 grantees submit their action plans or amendments to include those CARES Act funds, and more than 1.4 billion of CDBG-CV is in those grantees' lines of credit, with more approvals happening every day. HUD is providing flexibility to communities who want to use their existing non-CARES Act federal dollars as well for CDBG, ESG, home, and HOPWA to support coronavirus recovery efforts. Grantees have submitted a wide range of questions, waiver requests, and suggestions for CARES Act implementation, and all of them have been given very serious consideration and addressed holistically in the notice, which we'll go over in a lot of detail. But I do want to highlight a few points. States, under the notice, states are allowed to act directly to carry out activities if they choose with a portion of the CARES Act funding. We've also streamlined economic development and urgent need documentation requirements. We've extended emergency payments past 3 months out to 6 months. And also a big piece of the notice to keep in mind as you design your programs is that grantees have to expend 80% of the grant within 3 years, and that's from the date of the grant agreement execution. There's also an overall period of 6 years for the period of performance for these grantees. And this is unique, obviously, for the CDBG-CV funds. Another thing I'd like to highlight is the duplication of benefits requirement. Many states have prior experience with duplication of benefit, or DOB, because of disaster recovery funding that they've maybe received in the past. I will note that DOB is a little different for CDBG-CV, and we will be providing technical assistance on DOB in coordination with other federal agencies as well. And HUD will continue to support grantees with technical assistance from HUD field office staff, TA providers, such as the ones that are on this webinar with us today. As well, we have the HUD.gov and HUD Exchange websites with plenty of content, FAQs, past memos, and notices that can support your needs. And at the end of this presentation, we'll talk a little bit more about the planned technical assistance. We'll be taking Q&A at the end as well. And I do encourage you to submit your questions throughout the webinar, and we will address them at the end. And again, I want to thank you everyone for the work that you're doing, and I want to thank you for joining today's webinar. And let me introduce both Doug Carlson, Senior Consultant with TDA Consulting, as well as Randall Mullen, Vice President at TDA Consulting. They'll be going through the slides, and I'll be coming back at the end to help with your questions. Let me pass the ball to Doug here.
Thank you, Robert. Hopefully everybody can hear me okay. Good afternoon and good morning to everybody. I am Doug Carlson, a senior consultant with TDA Consulting. I will be presenting this webinar on state CDBG-CV implementation along with my colleague Randall Mullen. Thank you all for being here. I want to go over really quickly some of the objectives that we have for the webinar. We're going to go over a couple of the key components of the CARES Act, which many of you may be familiar with already, but we want to reiterate what some of those are. We're going to also go over the alternative requirements and flexibilities that are in the Federal Register Notice for CDBG-CV. And then we're going to specifically look at the state alternative requirements and flexibilities that are in the CDBG-CV Federal Register Notice and how they apply to your program delivery. And then we'll take some time to take a look at the options and models that are available to state CDBG-CV grantees, and also, as Robert mentioned, talk about available resources and technical assistance that will be forthcoming. So today, as I said, we're going to go over the CARES Act very briefly, just the main components of it, at least especially duplication of benefits. Then we will also go over the Federal Register Notice, the state-specific waivers and alternative requirements, scenarios, the policy guides that will be forthcoming. We'll have the Q&A at the end of the session, but please make sure that you submit your questions during the session, and they'll be addressed at the end by Robert. And we also have the expertise of James Heyman and Corey Schwartz from the Office of Block Grant Assistance. So we have lots of subject matter expertise on this topic for the end of the session. Then we'll go over again some of the available resources and forthcoming technical assistance available for the CDBG-CV program. So let's start with a brief overview of the CARES Act. So to date, HUD has allocated $3 billion of the $5 billion in CDBG-CV resources that have been made available, to the CARES Act. The first allocation used the existing formula CDBG methodology. The second allocation was only made available to states and insular areas on the basis of factors identified in the CARES Act: public health needs, risk of transmission of coronavirus, number of coronavirus cases compared to the national average, economic and housing market disruptions. The remaining $2 billion in CARES Act funding will be allocated in the future, and it may be allocated to grantees at the Secretary's discretion on a rolling basis, giving priority to the factors that I just identified in the CARES Act. Robert has already mentioned that there is a 3-year 80% expenditure requirement for this program. And so given the importance of this money being spent in a manner related to coronavirus, it's important for grantees to remember that HUD may recapture funds at risk of not being used and reallocate that funding to other grantees. One of the key components, as Robert also mentioned, in the CARES Act that is replicated in the CDBG-CV Federal Register Notice is regarding duplication of benefits. So what is duplication of benefits? A duplication of benefits occurs when a person or entity receives assistance for the same need or activity from multiple sources that exceeds the amount of need. So Robert mentioned the expansion of emergency assistance to 6 months. So if we use that as an example, if an individual applied for emergency assistance through CDBG-CV, but also received assistance from another source, it would be the responsibility of the CDBG grantee to ensure that assistance is not duplicated and the individual is not getting double the assistance for a given month or whatever time period is specified. So in order to address the duplication of benefits requirement, grantees must establish a set of policies and procedures for each program and activity to prevent the duplication of benefits. At a minimum, those procedures must include the requirement that anyone who receives CDBG-CV assistance must repay the duplicative assistance if and when it occurs. The second part of that requirement asks that procedures be established by grantees that basically identify the sources and uses of all funds related to their activities. And so any funds that will be received or will likely be received, and grantees need to act reasonably to evaluate the needs and the resources that are available to meet that need. So they have to look at everything that's on the menu, including their CDBG-CV funds, and make sure that those funds do not cross and duplicate assistance. So HUD, as Robert also mentioned, is going to continue to issue new guidance on duplication of benefits to help grantees understand and comply with the requirement. So in the interim, though, grantees must maintain documentation of all their CARES Act assistance available to them to help determine potential risks of duplication. So there is a table that is already created and is on the HUD resource exchange of federal resources that can be modified to reflect local assistance. Again, it's kind of looking at how you're combining resources to address the coronavirus. So the key here is that CDBG-CV resources are targeted where you know there are existing gaps or areas of unmet need to ensure that you're not providing duplicated assistance, that you're providing unduplicated assistance. So now we're going to go over some components of the Federal Register Notice. So this chart provides an overview of the flexibilities that are in the CDBG-CV Notice. Many of these are already familiar to you. You've probably seen them either in other webinars or you've actually created your own list of what's in the notice. So there are key components that are in the notice that are listed in each of the columns. That includes components related to the action plan and citizen participation process, modifications and clarifications to national objectives, changes to eligible activities, and CDBG-CV program-specific requirements, some of which have already been mentioned. We'll go into a little bit more detail on some of these flexibilities and alternative requirements as we go through the presentation. So the majority of the requirements that are in the Federal Register Notice for CDBG-CV apply to all CDBG-CV grantees. However, there are several changes and flexibilities that are unique to state grantees, and we're going to go over those in more detail later in the presentation. One of the things that's important to remember with respect to your CDBG-CV allocations is that they are subject, as CDBG is also subject, regular CDBG grants, it is subject to the 70% overall benefit requirement. So this applies as to CDBG-CV as well as to your regular CDBG program. So the 70% cap for CDBG-CV is not going to be tied to your formula CDBG-CV activities, and it's not going to be calculated by program year. Instead, for CDBG-CV, it's going to be calculated based on the overall percentage of your total CDBG-CV grant awards. So everything that's received by the state will be calculated against the LMI benefit requirement as one sum against the 70% requirement. The CV notice made some changes to the urgent need national objective. It's a component of the CV program that needed consideration. And so in considering urgent need, grantees need to address 3 questions under the criteria in the notice. The first criteria is the activity designed to alleviate existing conditions. And so in answering that question, a grantee wants to consider and demonstrate that the activity is preventing, preparing for, or responding to coronavirus. The second criteria under urgent need asks, does a condition pose a serious and imminent threat to the health and welfare of the community, and is it of recent origin? In order to answer that question, grantees can refer to HHS Public Health Emergency Declarations, the Federal Disaster Declaration that was issued, or your own state or local disaster emergency declarations. The third criterion is the grantee or unit of general local government unable to finance this activity on their own. To answer question number 3, HUD knows that there's extreme pressure on local and state government budgets, and so a tie back to COVID-19 response can satisfy this requirement. It's also important to know that in the CARES Act and in the CDBG-CV Federal Register Notice, that all activities that are funded with CDBG-CV must prevent, prepare for, and respond to coronavirus. So grantees can consider direct and indirect benefits. So direct effect could be the costs associated with prevention, preparation, or response, and an indirect effect can be the economic and housing market disruptions that have been caused by the coronavirus. It's also important to know that in the CDBG-CV notice, grantees are allowed to fund pre-award costs for eligible activities from January 21st, 2020. So to reiterate, all of these activities have to be to prevent, prepare for, or respond to coronavirus. And here are some examples of what grantees can do, what types of activities can be undertaken that will address the coronavirus response, the preparation for it, or the prevention of it. These are actually examples that were taken off of prior guidance that are on the HUD Exchange. You can use CDBG-CV funds to acquire and rehabilitate property for a group living facility for people undergoing treatment. You can do job retention related to loss created by the coronavirus. You can make improvements to housing units to help to have quarantining on a temporary basis. You can provide micro-enterprise assistance for coronavirus-related activities. You can rehabilitate community facilities for infectious disease responses. And of course, you can do public services to do testing, diagnosis, or other services at different locations. Another component of the CARES Act and the CDBG-CV notice regards the public services cap. For CDBG-CV activities, the public service cap is waived. The cap is also waived for any 2019 or 2020 CDBG activities when that public service is carried out to prevent, prepare for, or respond to coronavirus. It has to meet that criteria in order for the cap limit to be raised. So the other thing that states will need to consider when they're doing public service funding is whether the activity is for preventing, preparing for, responding to coronavirus, and they need to document that in their IDIS activity setup and not mix the purpose of the activities or change older ongoing activities. You need to make sure that all of your IDIS documentation is directly related to what you're funding with your CDBG-CV funding. Another component that is in the notice is changes to some of the economic development criteria that many of you are familiar with, especially regarding the public benefits tests. Under the CDBG-CV notice, the aggregate test, public benefit test, has been removed, and the individual public benefit test has been changed. It's actually been inflation adjusted. Since those initial figures that you see on the chart are fairly old at this point in time, so the new figures under the CDBG-CV requirement have made adjustments on the individual public benefits tests for costs not exceeding $85,000 or activities providing goods or services to residents of an area where the cost is less than $1,700 per low moderate income residents. So that's the changes in the public benefits test that are important if you're doing an economic development activity for job creation or retention. There are also changes to the financing mechanisms available under the CDBG-CV notice. So assistance can be made through any financing mechanism, including through opportunity zones and new markets tax credits, which has been done before as investment vehicles. And states can now allow certain nonprofits to pass assistance through financing mechanisms to other entities for their community and economic development projects. It's important to know if you're doing CDBG-CV related economic development, that the guidelines and objectives for evaluating project costs and the financial requirements that are at the end of the CDBG-CV regulations and are listed as Appendix A still apply to economic development activities. So you have to underwrite and evaluate your activities based upon the criteria that is in Appendix A if you're going to carry out an economic development activity with CDBG-CV, just as you would have to with regular CDBG funding. Robert spoke to this earlier, but it's also very important to know that in the notice, the criteria regarding emergency payments has changed. So HUD has extended the period of emergency payments from 3 to 6 consecutive months. This will allow grantees to more holistically assist individuals and households that were impacted by COVID-19. So emergency payments can include a range of activities. They can include assistance for food, for clothing, for housing, rent or mortgage payments, and utilities. It's very important to remember that all payments under emergency payments need to be made directly to the provider of the service, such as the landlord or the utility company, on behalf of the family, and that payments cannot be made directly to the individual or to the family. Program income is CDBG-CV program income is treated as regular formula CDBG program income when it's received. Program income should follow the same protocols and processes used to record and document and reprogram formula CDBG program income. So it is treated as it's received as if it is regular formula CDBG-CV program income. So it's important to remember that if you're generating program income from your CDBG-CV funds. So now at this point in the presentation, I'm going to turn it over to Randall Mullen, and Randall is going to talk about the state-specific waivers and alternative requirements that are in the notice. So Randall, I'm going to pass it over to you.
Okay, thanks, Doug. Yes, we are now turning your attention to the state-specific waivers and alternative requirements. Within the notice, there are several flexibilities and alternative requirements granted to states. Most importantly, states must use CV funds to directly carry out activities in all areas of the state. This includes carrying out activities in entitlement areas as well as non-entitlement areas and tribal areas with consent. The definition of subrecipients in the CDBG regulations is also modified to expressly include Indian tribes. Indian tribes that receive CDBG-CV funds from the state must comply with the Indian Civil Rights Act. 24 CFR Part 570-486C, a provision familiar to many on this webinar, is waived to allow states to use CDBG-CV funding for activities located in entitlement areas without a contribution from the entitlement jurisdiction. It's important to note, however, that states must publish the method of distribution for activities that will be carried out directly in the action plan or a substantial amendment. Now, we do note that that there are some states that have already submitted applications for CDBG funds. In those cases, the states may amend the action plan to modify this description and the method of distribution accordingly. If the area in which the activity is carried out would benefit from the so-called exception criteria, that is, those criteria that permit a grantee to use a percentage less than 51% to qualify activities under the LMI area benefit criteria, those exception criteria apply to the use of CDBG-CV funds by a state in the same way that they apply to the use of CDBG funds by the entitlement grantee in the same area. For state CDBG-CV grantees, the notice also makes several other changes. It eliminates the state administrative match requirement, something that is probably already noted by most on this webinar. It increases the state general admin and TA allocation percentage to 7%, broken up with 5% for general administration and 2% for technical assistance. If the state uses the full 7%, then this notice allows that 13% can be made available to units of local government for planning and administration. Under criteria in the CDBG regulations, HUD reviews a state grantee with respect to 3 items. 1, whether the state has distributed CDBG funds to units of general local government in a timely manner, in conformance with that method of distribution described in the action plan. 2nd, whether the state has carried out its certifications in compliance with requirements of both the Act and this subpart, as well as other applicable laws. And 3, whether the state has made reviews and audits of units of general local government as required by the regulations. Consequently, a state must establish and maintain records as necessary to facilitate review and audit by HUD of the CDBG-CV program delivery. This flexibility recognizes the constraints of the pandemic. However, fair housing and equal opportunity records must include data on race, ethnicity, and sex of persons who are applicants for, participants in, or beneficiaries of the program. It's also important to note that guidance on CARES Act reporting is forthcoming. Like formula CDBG grants, CDBG-CV funds are subject to review and monitoring by HUD staff as well. The CDBG regulations were modified to add subrecipients as well as UGLAs. Because states are now thinking about how to launch their CDBG-CV programs, we would now like to describe possible scenarios for implementation. This also might help you better understand the alternative requirements and flexibilities that I just went over. First, the previous guidance that Doug offered is from the CARES Act and the notice. It describes flexibilities that I have reviewed with you, which would expedite or facilitate implementation. The guidance also incorporates provisions of the HCD Act and CDBG regulations, including one phrase well known by many states, that is, maximum feasible deference in carrying out the program. But HUD does not prescribe models for states to follow in implementing their program. There are only possible scenarios for you to consider. A pass-through model, which is like the state CDBG program, and this new direct administration model, which is more like the entitlement community program. The chart on this slide will offer a graphic view of each of these 2 scenarios. On the left side is the pass-through model, which reflects the state CDBG program. Under this scenario, a state would receive its single award of CDBG-CV grant allocations and distribute that funding to a set of UGLAs according to a specified method of distribution. Now, I want to draw your attention to the asterisk next to the oval-shaped of identifying the award, which is representative of the single award that includes CDBG-CV1 plus CDBG-CV2 and eventually CDBG-CV3 CV3. As the HUD grantee, the state would not directly carry out CDBG-funded activities statewide. Rather, those UGLIGs to which funds are passed through would separately administer local programs with the option of engaging subrecipients. Looking at the right side of this chart, the direct administration model, on the other hand, would require that the state specify a different method of distribution from that used for the state CDBG program. First, the state must set aside an amount of CDBG-CV funding equal to its first allocation, that is, the CDBG-CV CV1 grant allocation. The state must also specify what activities it will directly administer and how it will do so. This could include engaging state agencies to directly administer the CDBG-CV program, or designating subrecipients to carry out activities on behalf of the state, as well as enabling UGLIGs that receive the set-aside funding to use local subrecipients as well. A further comparison and contrast of these two scenarios appears on the following slides. We will now take a closer look at each of the two models in respect to three factors: allocation, method of distribution, as well as advantages, disadvantages. Again, under the state CDBG program, a state grantee passes through its allocation to units of general local government, or UGLIGs. It would replicate that model for its CDBG-CV program. The present method of distribution in this scenario would allow for all the state's activities to be carried out by its UGLIGs. In turn, the UGLIGs could use contractors and subrecipients to assist in the program implementation, but the state's use of those entities would be limited to general administration. There are both advantages and disadvantages to this model. It follows the existing structure with the established roles and relationships, so few changes would be necessary. However, the approach potentially would strain the capacity of local governments across the state. The direct administration model, which I generally described earlier, reflects certain flexibilities under the Entitlement Communities program. A state would not pass through its entire allocation of CDBG funds to UGLIGs. The state would carry out activities directly, either through its state agencies or designated subrecipients, while also setting aside a portion of the award to its UGLIGs. Because this approach represents a departure from current policy, HUD determined that a different method of distribution would be necessary. Amounts of funds allocated for state activities to be carried out directly would be included in the new MOD, and that change would trigger a substantial amendment to the state's plan. At a minimum, an amount equal to the state's first CDBG-CV allocation must also be reserved for non-entitlement UGLIGs. Implicit in this requirement to change the MOD is a difference in how a state would use subcontractors and subrecipients to implement the program. A state's use of such entities is not limited as it is when implementing a state CDBG program. The state can call upon state agencies and subrecipients to carry on activities statewide, including public services that would entail perhaps emergency payments, health-related services, job training, and more, and economic development that could include assistance to small businesses and micro-enterprises, as well as the special financing mechanisms that Doug mentioned. UGLIGs receiving a share of the allocation set aside for non-entitlement areas would fulfill a second important role. They could be allowed to carry out a full range of activities at the local level. two levels of subrecipients, therefore, the state level and local level subrecipients, could extend to all geography of the state and possibly cover both entitlement communities and tribal areas. Clearly, this scenario requires adaptation to a different set of state grantee subrecipient roles and relationships. The model might create an administrative burden that could strap a state's capacity. However, a state can expand its capacity by perhaps incorporating features from related programs, such as the Emergency Shelter Grant Program, ESG. In so doing, it might complement existing state programs and resources, tap those subrecipients that have effectively responded to the coronavirus, align strategic priorities and enhance capacity to carry out program activities, and better avoid the duplication of benefits. The potential exists for this approach to offer a more robust strategic response to the pandemic, enabling the state to fully address both the public health crisis and economic recovery. Of course, a state's decision about how to implement its CDBG-CV program requires that it assess current conditions and consider otherwise how it must prevent, prepare for, and respond to coronavirus. Each state may choose within broad guidelines the exact approach that meets its present needs and promotes recovery. Okay, it's now time for the question and answer period, and I'm going to pass the ball back to Doug to begin raising those questions of our HUD experts.
Thank you, Randall. So lots of great questions coming in on the Q&A. I will try to go through them, as many of them as I can, and ask the experts to help answer them. Just one second, I'm scrolling up. So the first question that we have is for the low moderate income national objective calculation, the 70% requirement. Are CDBG CV1, CV2, and CV3 funds combined for the calculation as a single grant, or are the three allocations different grants for the purpose of meeting the LMI national objective requirement? So Robert, you want to help with that one?
Yeah, sure. Thanks, Doug. Yeah, I could see why you would ask this question. So CV1, CV2, and CV3, which is coming soon, it's a single grant, right? So the overall public benefit calculation is determined, the overall benefit is determined for that grant, separate from your ongoing annual formula grants. With your annual formula grants, you can choose a 1, 2, or 3-year period, and that is still the case. So theoretically, you could have a 18, 19, 20 period, and if that's the case, the CV funds would be separate from your regular annual allocation, and the 70% would be determined on the CD grant alone. And those three allocations that are part of that single CD grant are considered part of obviously the single grant. The 70% is determined on that basis.
Thank you for answering that question, Robert. We have a second question, Doug, that I'll ask of Robert. Can COVID funds be used to acquire, construct, and rehabilitate emergency shelters?
Yes. We always ask the question of what's the eligible activity, what's the national objective, and in the case of CV funds, there's an additional question: what is the tieback to coronavirus? How are you preparing for preventing or responding to coronavirus? And we've seen lots of circumstances where grantees have proposed emergency shelters that are in response to trying to create more space, to provide quarantining opportunities. So yes, this is an eligible type of activity.
Thanks, Robert. I'm going to bring up the third question that we have. And that question is duplication of benefits also considered at the state level to include all types of funding? Examples would be other CARES Act funding and emergency shelter grant.
Yeah, of course. Of course, if you think about duplication of benefit, it's pretty simple. You're not going to pay for the same thing twice. When you look at the cost of an activity, you can mix funding sources. You definitely mix funding sources, but you never want to exceed what the activity would normally cost, a reasonable cost for that activity. And it's applicable at the state level as well. It's really just what's different, I think, for folks is that if you have experience with the disaster recovery program, CDBG-DR, they have an order of assistance. And in this case, with CARES Act funding, that is not applied, so there is no order of assistance. So you're just looking at, essentially, it's a reasonable cost test, and what's the total cost, and you're looking at your multiple funding sources. And you don't want to obviously pay for the same thing twice.
Thank you, Robert. So no double dipping. Question 4 is this: if costs associated with addressing COVID-19 can go back to January, how are these costs covered in the environmental reviews that have not yet been completed?
So you want to look at our pre-agreement and pre-award provisions. I believe in the state program we call them pre-agreement, in the entitlement program we call them pre-award. The way it basically works, in a kind of the rule of thumb, is that when you're spending your own money, maybe as you did back in February or March, you would have had to treat your own money as if it was CDBG money in order for you to be able to reimburse those costs. So that means that if you've incurred costs, you've gone through some choice limiting actions, I believe is the term of art, then that would have to have had the environmental review done in accordance with the type of activity and everything. So yeah, you can't. You would have had to have done both.
Hey Robert, this is Jeffrey.
Thanks.
On the question wasn't directly on pre-award. You're absolutely correct for pre-award, but if you're reimbursing back to January 21st for a cost that you had no idea that the CARES Act funds were coming, but it was otherwise CDBG eligible, then the Office of Environment and Energy contact your environmental review specialist, because the deal on that is you're going to have to complete the environmental review prior to committing funds to that activity. And they can walk you through how that works. That's a special, different thing from the CARES Act piece. But we don't really give environmental advice beyond what we know is in the regs for pre-award.
Thank you, Jesse. I think there is a memo or notice of some kind on environmental reviews that was just posted a week or two ago on the exchange. Is that correct? I'd have to look it up and see if I can find a link, but.
Yeah, I think we put a link to something environmental in the notice, which will then jump you to the environmental page.
Thank you. And I think at the end of this presentation for everybody, there are links to a number of resources, and I actually believe that one of the resources on environmental reviews is one of the links at the end of the presentation.
Yes, that is correct.
Okay. So let's move on to, which question are we on now?
Number 5.
We are on question number 5. Ari, I knew this would generate a question actually. Regarding the statement not to mix activities, when we have a general CDBG 2020 activity that is partially in response to COVID, and partially routine. Do these need to be input as separate activities in IDIS? Homeless services demands pre-COVID and now increased, I'm assuming increased resources need to go for homeless services. So the question is, do you need two activities when you're funding something normally with CDBG and now you want to fund it also with your CV funds?
Mm-hmm.
Yeah, so the answer is yes in terms of how you enter it into IDIS. It's important to keep those separate. When you are in IDIS, there's an activity setup screen where you are indicating which programs you will fund the activity with. Home is at the top, and there's a small table. Or I'm sorry, CDBG is at the top, followed by home in this little table. And there's a question in there as to whether or not that activity is to prepare, prevent, or respond to coronavirus. And there's two choices, yes or no. There's not an option to have a mixed activity. The reason for that is because it has implications for how your public service is calculated. Right? So obviously the public service cap is lifted for coronavirus response, not just for CDBG-CV, but for the 19 and 20 funds as well. And in addition, you want to consider the fact that if you have an activity that's marked as not being in response to coronavirus and you put CDBG funds on it, then that would be a problem as well, because the CDBG-CV funds are only for activities that are to prepare for, prevent, or respond to coronavirus. So you do want to separate those two.
Okay, Robert, we have a question related to the substantial amendment. The question is, the setting up of a substantial amendment for CARES Act funding instructions direct you to enter the combined amount of CDBG and CDBG-CV funds for this project in the estimated field, and there's a reference to page 6. Is that correct?
Okay. So there's a couple places in the annual action plan or substantial amendment of the action plan that you would you'd be entering your CDBG-CV funding and your CDBG funding. There's a resources table, and we've asked that you provide those funds separately on the resources table by entering other and then providing the CDBG-CV funding. Now, I believe the question is regarding project budgets, and those project budgets are not grant specific. So you can provide dollar amounts that do combine multiple annual formula grants as well as your CDBG-CV funds.
Okay, let's get to question 7. Does it matter who owns an emergency shelter in order to receive CDBG-CV funds? Can construction of emergency shelters be done by others than CBDOs? So I guess this is a question about nonprofit versus private types of facilities. Robert?
Yeah, so if the construction can be done by others than CDBOs, so I believe there's a bit of a confusion here because, as you know, with CDBG fund, new housing construction is not allowed unless you're a CDBO. However, an emergency shelter is not considered to be housing for this purpose. It's considered to be a public facility. So they can be done by the local government or subrecipients. And no, it doesn't matter really who owns the shelter.
Okay, Robert, we have a question in regard to timely, I think that is supposed to mean disbursement. Please confirm CDBG-CV funds are subject to the timely distribution requirement, this actually says, but the CV funds be included on the timely distribution report to HUD.
Okay. So with as you know, with the state program, entitlements, they track their timely expenditure, and they have a goal, or they have a requirement of having a balance of 1.5 times the grant. But you guys know in the state program that we do it a little bit differently, and we have a requirement that you publicly announce your awards to your units of general local government within 15 months. Okay, and that's still applicable for the regular annual formula allocation. It does not apply to the CDBG-CV funds. You're not required to publicly announce the awards of your CV funds within 15 months. There's a few reasons for that. Well, the biggest one is that you can act directly as a state for a portion of your funding. So we've therefore waived that requirement that you pass those funds forward to the local governments within 15 months, because you obviously won't be doing that with all of your funding. If you choose the option to run a portion of your program directly as a state. And I should also point out that in the notice, it mentions that the timely distribution requirement for the regular funds has not been waived, but that enforcement actions will be foregone, I believe. So we are expressing some leniency in terms of the 15-month requirement for your annual formula application.
Thanks,
Robert, is it?
Oh, I'm sorry. Go ahead, Randall.
Is this also a good time to reiterate the 80% requirement?
Absolutely. That is one of the biggest differences between the regular program and the CV funds. You have 3 years to spend 80% of these funds. And additionally, there's a 6-year period of performance.
Thank you.
Speaking of projects and spending funds, the next question is about broadband. And the question is, if we have a broadband project, laying infrastructure or installing a tower, that can be completed within a year, assisting rural communities which telework, need telemedicine, and hybrid school support for remote learning, is this eligible as something to prepare or respond to coronavirus?
I'm going to say generally yes, but I'm going to call on Jesse for some support. I'm going to phone a friend because I
saw that question in the chat and I knew. Because we've been talking a lot about broadband, particularly comes up in rural and in hard hit urban areas that are very low income. We have concerns about all construction projects, right? Because of the 3-year deadline. We know the typical construction expenditure pattern is a 4-year pattern, not a 3-year pattern, and particularly in states. And so right there, I'm just going to put timeliness on the table. It's a very serious question. If you are, I'll tell a story that I've told on a few webinars, and a bunch of you have probably heard it, and you're probably sick of it, but it's this story, right? If you had clearly this is a project you had planned, right? Maybe it was on the back burner or whatever, but now it's moved to the front burner. But clearly, you wouldn't be this far in asking this question if you hadn't already planned it. So I had a grantee come to me and say they wanted to fix a Main Street and make it, have nicer sidewalks and nicer facades and fix the street up a little bit and spend their CV money on it. And I was like, what in the world does this have to do with prepare, prevent, respond to coronavirus? And they said, oh, we've changed the design so that, they can have outdoor seating and it's going to be safe so that people can pull up and do pickups without impeding traffic. And we're making the sidewalks wider and putting in, better ventilation and in some of the restaurants. And, we're doing all this stuff and, we have a hand washing station. And I was like, why didn't you lead with what its link is to prepare, prevent, respond? And it's a significant portion of the project cost, and a lot of the design cost went into doing this. Yes, it will give them a long-term legacy, better neighborhood area, but it'll also potentially save these businesses that are otherwise going to go under, and the grantee did its homework. So if you're saying we were going to bring broadband before, we want to bring broadband now, and we're just patching on a CV coronavirus reason to it, you know, I'm going to say, tell the story for real. What are the design elements that are really taking care of this? Who is it going to actually use it? Are you bringing a line out and the only entity that can sign up is a business at the other end of the line that the households can't get on? Who are you really serving? Do you meet a national objective? And can you get it done in time? All the usual questions, right? States have maximum reasonable deference on an admin, and we give you a lot of room on eligibility determination, but you gotta hit all the marks dead center, you know?
Jesse, no matter how many times you tell that story, it is still very instructive. Thank you. Thank you for going back to that particular story.
Great. Well, thank whichever Florida grantee, I think it was Tampa, who asked it in the first place.
Question number 10, Robert, is about states acting directly to administer the CDBG-CV program. States must allocate the amount of equal to their CDBG-CV1 grant for use by as a set-aside for non-entitlement areas. And the question is, do those dollars have to go to the UGLUGs, or can the state spend those funds in the non-entitlement areas of the state?
Thanks for that question. So the notice says that that set-aside is for the non-entitlement units of general local government's use. It's for their use. So a scenario where the state continues to act directly for the entire allocation and somehow tries to demonstrate that they've spent so much money in a non-entitlement area. That's not what that means. What that means is that we're talking about a more traditional, more common MOD, method of distribution style of a program where you're awarding the funds to the units of general local government for their use. An important point is that we say an amount equal to CDBG-CV1. So if you look in IDIS, you'll see that your CV1 and your CV2, and eventually your CV3, potentially, will all be on a single funding line as a single grant. So you're not able to sort of designate CV1 for this purpose and CV2 for that purpose. That's why it says an amount equal to. So it's incumbent on you as a state to make sure that you're properly budgeting that out and awarding at least an amount equal to that CV1 allocation to your units of general local government. You don't necessarily have to act directly with the remainder. You could do awards to your units of general local government for the full award for all of your CV1, 2, and maybe 3. But you do, for an amount equal to at least that first round, you do have to provide it to the UGLUGs for their use.
Thank you, Robert. That's a good question and a clear answer.
And I think the next question is very much related to that, to what you just talked about with respect to using direct admin and pass-through. So the question 11 is, can a combination of direct administration model and the typical pass-through model be done? For example, we would like to do the emergency rental assistance, emergency payments using direct admin, while others are done through the pass-through model.
Yeah, they can do that. Definitely, you can definitely mix the two. But as I said, you want to keep track of how much you're funding these particular activities for. So this is another good reason to make sure you're setting up activities in a way that's going to help you keep track of what you're doing for coronavirus response, not mixing things. because this is another reason why you need to make sure you're budgeting your activities, your activity funding, especially for activities that, in this case, are things that are for local government use. So they're making the decisions, right?
It's encouraging to learn that states are thinking about the alternative, using the alternative requirements and flexibilities, especially with regard to administration. Question 12 regards the citizen participation requirements. It reads, the public meeting requirement for regular CDBG is 6 months prior to application submitted. There is a waiver for public meeting. Is there a waiver for public meetings requirement for communities for the CDBG-CV?
Interesting. So you said that there's a requirement for regular CDBG, which says something about the applications or for the public hearing being 6 months before the applications are submitted. I'm assuming that's the application from a unit of general local government to the state, and the state is requiring that public hearing occurs 6 months ahead of time.
Yes, because that's not actually a HUD requirement.
That's right. It's not a HUD requirement. So it means you got a lot of flexibility there as a state.
Mm-hmm.
Not only that, but the notice does describe that those local government requirements at 570-486 are still in effect, but they can be expedited, and you can do virtual hearings as well, right? So, so you may need as whichever state asks this question, you may need to modify your policies and procedures to allow that expedited process, but you shouldn't have a problem otherwise.
Okay, question 13 asks, can funds be used, I'm assuming meaning CDBG-CV funds, be used to purchase a vehicle for a homeless shelter to provide socially distanced transportation to public services like job placement, etc.?
Interesting. I know somebody that knows a lot about vehicle purchases. I'm going to phone a friend again. Do you get through, or is it a live? Is it another? Maybe I can ask the audience. No, I'm kidding. Is James available? I believe James is our resident expert on vehicle purchases.
Vehicle purchases, huh? As a public service, I mean, under the regular formula program, we have seen some transportation vans purchased by elderly centers, Meals on Wheels, things like that. I think it really depends on how this is designed, and sort of what you have in your policies and procedures in terms of cost, and what the long-term aspect is. You could purchase it as needed for the carrying out of the public service, but you do have to follow the equipment guidelines, and we do have, I believe it is Exhibit 34-4 in the Grantee Monitoring Handbook that you can use and adopt that piece into your policies and procedures, because you'll have to go through the aspect of actually not only maintaining the vehicle, but actually having the inventory, doing the depreciation and things like that are in 2 CFR Part 200. So you may have to do some gymnastics in terms of your policies and procedures and how you're set up in that agreement in order to do that. Haven't actually had that
Paul Webster would tell you to lease it.
Yeah, I mean, this is not, when we're looking at some place like Meals on Wheels, the community center aspect of it, that's usually a long-term purchase. And I think we haven't seen this question yet in terms of how this would work with a homeless shelter. I'd actually like to talk to you about that.
Okay, question 14, Robert, actually might relate to duplication of benefit. I will read the question and help interpret it. If a grantee establishes an emergency rental assistance program, that is, makes emergency payments, can an applicant who's living in an affordable housing complex, and I'm presuming that they're referring to a complex that perhaps has been supported with CDBG, be eligible for CV funds for rental assistance? Perhaps we could answer that question both ways. I mean, if the affordable housing complex is not supported with CDBG, or if it were, the potential, of course, exists of duplication of benefit.
Yeah, you definitely raise a good point. This notion of assisting a person with their cost of rent for a facility or for something that's already supported by the program. I think we definitely need a little bit more detail here. I don't know
Yes.
if Jesse would like to weigh in.
Well, I thought the question I saw, at least one of them in the chat, was, you know, if you did their roof with CDBG, can you pay their rent with, or mortgage, and their housing payment with CV? And the way to think about it is you did their roof with CDBG because that wasn't a pandemic need. So it drives you back to what is the need? Because DOB is all about not paying for a need twice. So they have one need for a roof that doesn't rain on them, and they have another need for not getting thrown on the street during a pandemic. Mm-hmm. And then you walk through your duplication of benefits. What is the need? What are the sources? Do we have a duplication? So in this case, I don't think that they would mostly duplicate each other. But
Makes sense.
To have the case specifics and walk through them for that individual.
Thank you, Jesse.
Okay, I knew that I would get one of the tougher questions. and I know that Robert and Jesse really want to answer this one. The question 15 says, can local government-owned utilities be the recipient of utility payments on behalf of a household receiving an emergency payment?
We've gotten a lot of questions about this, and we are developing more guidance. This is an area where there are things you need to be cautious of. I mean, the general answer is yes, but there's a lot of things you're going to have to be very, very cautious of when doing this. There's this perception that the local government would be paying itself. That wouldn't be necessarily appropriate if those payments are somehow going back to the local government's general fund. That wouldn't be appropriate, and we'll be fledging out those parameters for you shortly and providing better guidance on that.
Yeah, and James, with another issue on that, Robert, around special assessments. I mean, I guess you both have, right?
Right.
If any of the payment includes a special assessment, then you're tripping over, you know, a CDBG cert.
Yeah, you have to be careful if the utility had been assisted with CDBG funds, so maybe the water system had been installed with CDBG funds, and then you're trying to recover those capital costs by charging them against the customers and then paying that with CDBG funds. Again, that would be problematic as well.
Tricky question.
Yeah, it is.
Question 16, Robert, is again about states acting directly. It reads, in a direct model, if an interagency agreement was signed between two state agencies, how are payments done? Will the original state grantee be processing the payment as the funds in IDIS or under the original grantee in IDIS?
So I don't mean,
of course.
yeah. I'm going to answer the question. And listen, especially with CDBG-CV funds, we're seeing a lot more of other agencies getting involved. Just the nature of the crisis, right? And that's great. That's great. We, as HUD, our relationship with the state is just that. Our relationship is with the state. We want to see appropriate agreements between the agency partners. But frankly, if we come and we monitor, our finding will be made against the state, not a particular agency. When we look at your compliance, it's about the state. When we look at how much you're spending, it's about the state as a whole.
Because the grant is to the state, not to the state agency.
Exactly. So I don't mean to sound unsympathetic, but that is an area that we stay out of. I mean, we're sympathetic, of course, but we stick to that. We stick to that mantra that our relationship is between the state and HUD, and whichever agencies are designated to carry out the responsibilities. We do want to see appropriate agreements, of course, but we're not going to be involved in disputes between agencies. That is for the state to work out.
Thanks, Robert. Question 17 is around duplication of benefits. And the question is, if the local government knows that there is no duplication of benefits, do they still need to adopt a duplication of benefits policy? I think I know the answer to that one, but Robert, you want to take that?
Absolutely, they do, yes.
Yeah.
It's a requirement. Yes, it's a requirement. We need to be able to prevent that duplication of benefit. You have policies and procedures to do that. The fact that you know that there's not going to be any duplication of benefit is encouraging. It sounds like you're well on your way to having a policy. So put it down on paper.
And again, as we mentioned in the webinar, there will be more information coming on duplication of benefits through the Office of Block Grant Assistance. So more info is coming on this topic.
Yeah, and if I can,
Robert,
if I could just mention here that in the notice that's going to be in section 3B9 on duplication of benefits, and it does state in there, as we pulled out of the CARES Act, that the grantees are required to develop and maintain adequate procedures to prevent duplication of benefits. And in that section of the notice, there are two things in there that those policies and procedures have to actually have within them. And one of those is something that needs to go inside an agreement, which is if there is a duplication, they need to repay the assistance. And the second one is actually having a method to assess whether the CDBG-CV funds will duplicate financial assistance that's already been received. We've already have posted some duplication of benefit guidance on the COVID-19 section of the website, and we do have more that are coming.
And that latter item that you referenced would be much like the worksheet that is used in the DR program. Correct.
Yeah. Like I said, there is some up on there, but I would definitely take a look at that section 3B9 in the notice, and it would be the third paragraph down has the two pieces that it must contain.
Robert, the next question, 18, is a follow-up on the question raised earlier about the HUD grantee for states being the state itself, not a particular agency. If a state elects to carry out activity directly, do we need the chief executive of the state, I presume that would probably be the governor, to designate us to do so? Or in that regard, our ability to designate another state agency to carry out the activity?
It's an interesting question. So the way that the Housing Community Development Act reads, if I recall, is that it refers to any instrumentality of the state designated by the chief elected official. So if you have an agency that's getting involved for the first time, then they would have to be designated by the government. Sorry, I just received a phone call at the same time, distracted. So if, in terms of just acting directly, I don't know. The agency that already is administering the CDBG program is already designated by the governor. So no, there wouldn't have to be. And James can correct me if I'm wrong, but I don't believe there would have to be an additional designation for that same agency to continue administering the program and acting directly if they choose to do so.
James, do you want to amplify on that answer?
Yeah, I mean, this is something that we don't run into, right? Because all the states are in the program. We're not quite like DR, where DR is actually, this may be a grantee that actually has a DR grant and has seen this. On the DR side, they actually do require, a statement from the governor or whatever, declaring which agency is carrying it out. We've gotten a number of questions over the years where, grantees may want to receive that and then kind of like split that amongst two different departments or whatever. From us, our perspective is we're dealing with the state and what happens inside your state and what kind of agreements and things like that. That's not necessarily our business, although we do need to know who actually is receiving it, and we need to have, those signatures on there. I think from the perspective of oversight, as we're kind of looking out, and the CARES Act does have a GAO oversight piece. It also has an OIG oversight board that is being created. We've seen some of the GAO piece, and we have not seen anything on the OIG. Just as a reminder, those are auditors. They're not program people. So I would actually go ahead and cover yourself in terms of having, whether it's a statement from the Attorney General, something signed by the governor, or whatever that designates which agency is actually carrying out not only the program, but if you're going to go to a model that looks more like where the local government may have, say, their planning department receiving the CDBG grant, and they're going to carry out an activity directly through a park, and they sign an interdepartmental agreement between the planning department and the Parks and Rec department to carry out that activity directly. I would go ahead and do that to make sure that you have everything covered in terms of your agreement and the appropriate clauses.
I agree. An MOA or an interagency agreement is the prudent way to go, clearest for the roles, and it's worked really well for disaster recovery as well. And some urban counties do it. The designation, so long as the designation is to the agency that signs the grant agreement as the fiscal agent, that's a statutory minimum requirement. Additional designations just will make it clear, and they can help your, if you have multiple agencies, play well in the sandbox. Because everybody's going to have to give the main agency or the designated agency for the fiscal agents or role all the reporting documentation and stuff.
Mm-hmm. Doug, we have time for a few more questions before we wrap up with the final slides regarding resources, HUD links, and so forth.
Okay, thanks, Randall. Question 19 is hazard pay for staff and eligible costs for CDBG-CV subrecipients in entitlement cities? That's two questions, actually, I think.
Interesting. I'm leaning towards what the grantee's own policies and procedures would say regarding staff costs.
Yeah, and there's a 2 CFR element as well. We have an answer to this from the financial side as well. And it's got to be hazard pay related to the pandemic. We've had this question a lot related to civil unrest, and that's not the response to the coronavirus.
Jesse, don't go anywhere because we have another broadband-related question.
Well, actually, unfortunately, I popped up again mostly because I do have to. I have to jump off. I've been recruited for another meeting that's starting right now.
Okay, well, Robert.
We'll collect all the questions, and we'll make sure that sooner or later we're going to answer as many as we can today, and then, you know, we'll keep at it. We've got this big TA effort standing up, so.
Well, thank you, Jesse.
Thank you,
Thank you,
Jesse.
guys.
Okay, and that's probably a good segue to the concluding slides. Doug, what do you think?
Yeah, I think since we only have a couple more minutes left in the presentation, I'm sorry, did somebody want to say something?
We could continue taking a few questions.
Oh, okay.
Well, if you're game, I'm game. Let's do it.
UGLAs may use CDBG-CV funds to provide broadband service for rural areas with limited internet access. School children need access. How do we provide LMI benefit information? Census plot group data?
All right, so I'm going to ignore the broadband portion of the question. I'll refer back to Jesse's prior comments about broadband. I'm just going to focus on the area benefit piece of this. So in terms of area benefit, you know, with school children, we have school districts. We don't provide LMI data at the school district level. You know, as a geography, we don't provide school districts. We provide block groups. We also provide places. So in a lot of rural communities, the place level geography may match up relatively well with the school district. And as long as that's a reasonable match, they do not have to be coterminous. So you can use the place level geography. We also have county subdivisions that we provide. So there's a lot of options you have in terms of looking at the data to find a reasonable match to the service area of activity and matching those geographies. And if they don't line up, then your other option is to conduct your own survey. Right? So.
Okay, and we probably have.
Sorry, Rand. Almost all utilities and other services do define their service area, so there may be a way to overlay that service area with LMI information. And don't forget that the exception criteria can be used by states with their CDBG-CV funds as well as applicable.
Yeah, this may be the last question we have time for. Question 21. A lot of religious organizations have expanded food pantry and meal preparation for residents in rural Vermont. Is it correct that to be eligible for funding, these organizations need to income survey the beneficiaries to determine at least 70% are LMI?
Interesting. So I encourage you to look at the limited clientele national objective, and there are some classes, I suppose, folks that you can presume to be low and moderate income people, including homeless, elderly, provided that there's no information that would contradict that determination, no other income determination that would contradict that. So
that's good advice.
Yeah, you're looking at the 51% on that limited clientele, not the 7. Yeah.
Yeah, good point. The other question was asked, at least 70% online. So to clarify, 70% is for all of your expenditures for activities that benefit low and moderate income people. Now, an activity that benefits a low and moderate income person gets to be considered to benefit a low and moderate income person if at least 51% of the folks are low and moderate income. And I think a lot of people will confuse that. So essentially, in theory, if you funded a lot of activities and every one of them benefited exactly 51% LMI persons, but that was the only thing that you funded.
Well, thanks again to our panel of HUD experts. We have now reached the end of our webinar, and I simply want to refer to the additional resources and a bit of other information that has been mentioned previously, there will be upcoming webinars that are listed on this slide covering many of the topics that came up during these questions and answers. There are companion quick guides that will elaborate in detail and likely include the specific tools that will be necessary to demonstrate compliance and take advantage of the alternate requirements and flexibilities. And there will also be the CV on-call TA that states can request through the HUD exchange, and there will soon be a new method on the landing page to similarly make such requests. We want to also point out to you that there are these HUD links and resources which are available to you. Doug earlier mentioned the environmental guidance that is listed last. We urge you also to ask a question at the HUD exchange, as well as reference back to the notice itself for specific guidance related to what has been covered today. And lastly, I'll remind you that the PowerPoint slides and recording will be available on the HUD exchange a week from Friday, so you may refer back to what has been discussed during this webinar on that occasion. Lastly, if you have further need to contact Robert Peterson, here is his email address. Most of you probably know how to reach him, but he is the Director of States and Small Cities for the CDBG program, and you may contact him as you wish. Robert, is there any parting words that you would like to express?
I just want to thank everyone for participating in the webinar and for your work. Again, I think that we like to say that HUD has the best mission in the federal government, and you, the states, are really our partner in this carrying out our programs. You're the ones that are really working with your communities, and they need you now more than ever. So we're working our best to support you in your efforts, and I really want to thank you for everything that you're doing.
Thank you, Robert. Goodbye, everyone.